Doctors, we are all too familiar with the usual treatment of hypertension. Most of us prescribe medication for it to be taken by patients on an almost daily basis. But as cardiologists, we are here to tell you there is another way. This is renal denervation therapy. My name is Dr. Alan Fong. I'm from the Sarawak Heart Centre and I'm consultant cardiologist. Hypertension is a major disease burden. The Health and Morbidity Survey in 2019 confirmed that 3 in 10 adult Malaysians have this disease. Heart disease is the leading cause of death in public hospitals. Many patients face a lifetime of 3 or more medications and lifetime restraints. The burden of these multiple medications means that up to half of your patients could become non-adherent to the prescribed therapy within just 1 year. Many more patients find their hypertension remains uncontrolled despite proper diagnosis and medical intervention. This leaves them at risk of serious consequences such as heart attacks, strokes, kidney failure, blindness, and even death. This doesn't just impact patients, it impacts whole families. For stroke, a lot of stroke victims are dependent on care for at least 1 year, and this is a massive problem for many families in Malaysia, either financially or physically. There is another way. This is renal denervation therapy, already proven to be effective against uncontrolled hypertension.
Renal denervation therapy is a safe and viable alternative that offers a significant reduction in blood pressure and the risk of a cardiac event. My name is Dr. T.K. Ong, and I am the head of the Department of Cardiology at the Sarawak Heart Centre. Renal denervation therapy is minimally invasive and takes about 1 hour. Using radiofrequency waves delivered through the new Simplicity spiral catheter, 4 points of ablation are administered simultaneously to the renal nerves. It is a one-off treatment proven to produce sustainable long-term benefits. As an adjunct therapy, it offers a sustained drop of up to 10 millimeters of mercury, and there is no rebound phenomenon. In fact, the Global Simplicity Registry showed that with a combination of renal denervation and medication titration, at the end of 3 years after the procedure, the blood pressure might drop as much as 30 millimeters of mercury. The majority of patients are eventually able to reduce their medications and maintain a drop in blood pressure. In fact, for some patients who have been taking 3 or 4 or even 6 types of pills every day, the number of pills can be halved after 1 year of the procedure. That represents a significant improvement in their quality of life and a significant reduction in their risk of complications from hypertension. There is also a significant number of patients whose blood pressure cannot be controlled, whose blood pressure remains high, regardless of what we do. We can put them on multiple medications, put them on combination drugs, we can tell them to observe aggressive lifestyle modification, lose weight, and so on. But despite all this, their blood pressure remains high. Now, we cannot leave these patients alone. If there is an opportunity for them to try something that could be beneficial for them. Because if we don't control their blood pressure well for these patients, then we put these patients at increased risk of getting a stroke or a heart attack or heart failure or dying prematurely. So there is a clinical need for an additional treatment for uncontrolled hypertension. We need to provide for patients who are not responding to conventional treatment.
Awareness is now the key issue. Patients and medical professionals need to know there is an alternative, non-drug intervention to treat uncontrolled hypertension. Patients who are referred to a tertiary center that offers renal denervation therapy can discuss the risks and benefits with a cardiologist and then make an informed decision on this therapy. We will determine conclusively through our own rigorous protocols whether they are a suitable candidate for renal denervation. I think by giving a patient a choice and the healthcare professional having time as well as knowledge to engage with them, such as the patient is involved in the shared decision-making process, I think this is very important.
There is another way to treat uncontrolled hypertension, and this treatment is available at the Sarah Heart Center under one of the country's leading cardiologists. Patients can meet the team to consider this new treatment option together. There is now a choice for these patients.